Good afternoon. I'm Rep Perlman, and welcome to this week's edition of the Center for Houston's Future Leadership Webcast series. These webcasts are intended to inform, educate, and engage the community on a range of important topics and issues affecting the Houston region. Through these conversations, we are building a framework on leadership in times of crisis, looking at how we respond to the complex and systemic challenges such as posed by this pandemic. We have discussed the phases of a crisis and the role of leadership in a crisis with our first three speakers, Angela Blanchard, Judy Lee, and Senator Kirk Watson. And we have asked our public health experts, Dr. Eric Bauerwinkle and Dr. Stephen Linder, to help us understand the transition from emergency to recovery. And we've had discussions on what we've learned so far and what is needed to go forward. We're fortunate today to have two national leaders in public health and business, both from our community and from the Boston area, to discuss all of these topics. Through these discussions, we hope to consider the implications of the current situation and determine what actions we as a community must take to ensure the cultural, social, and economic well-being of the Houston region. And so now I'd like to introduce our moderator, Russell Richard. Russell?
Thanks, Brad. Good afternoon. I'd like to welcome everyone to today's webcast. We appreciate you tuning in. I'm Russell Richard, Vice President of Leadership and Engagement with the Center for Houston's Future. The center was established in the year 2000. This year is our 20th anniversary. The center works to convene business, government, and community stakeholders in fact-based strategic planning and collaborations on issues of the greatest importance for the future of the Houston region. I'd like to take a moment to acknowledge the center's leadership alumni on the webcast today. Thank you so much for your support of the center and our work. For those who'd like information about the center or our leadership program, please contact me or visit our website, futurehouston.org. Our next leadership forum is scheduled for September 24th of this year. The class is already half full, so please contact me soon for more information about the program and registration. Today is the 8th in our webcast series. Last week, we emphasized that we can't go back to the way things were. We must move forward and we must change. Today, we want to focus on the reopening of the state and the Houston region. How do we reopen safely? How do we recover? How do we move forward and get better? We will have a full Q&A at the end of the conversation, so please use the Q&A feature in your Zoom app to submit your questions during the conversation. Also, please feel free to chat with others on the webcast. Today, I've got two guests from different parts of the country, both respected leaders in their own industries, Scott McClelland and Dr. Asaf Bitton. Scott McClelland is the president of HEB Food and Drug Stores. HEB is a $25 billion retailer that operates 390 stores in Texas and Mexico. Scott oversees the operation of all HEB banners in Texas. Previously, he served as president in HEB's Houston region. HEB strives to be a good corporate citizen, and as such, Scott serves on a number of local boards. HEB has implemented many innovations during the COVID-19 crisis to support its operations and to protect its customers and its associates. Dr. Bitton is the executive director of Ariadne Labs and global expert on primary care policy and delivery. He is the founder of the Primary Healthcare Performance Initiative, a partnership that includes the World Bank, the World Health Organization, and Bill and Melinda Gates Foundation. The organization is dedicated to transforming the global state of primary health care. Ariadne Labs' mission is to develop simple, scalable solutions that improve the delivery of healthcare at critical moments to serve lives and reduce suffering. The lab's focus is on systems and healthcare delivery that provide unique understanding of the complexity of decision-making in a rapidly changing crisis. Scott, Dr. Bitton, thank you so much for joining me. It's great to have you on the webcast.
So nice to be here.
Well, I'm really excited to have the both of you. Dr. Bitton, do you mind at all if I call you by your first name?
Oh, please call me by Asaf, absolutely.
All right, well, thank you very much. It's good to have you. This is very exciting. This is the first time we've hosted guests from two different parts of the country. And so we want to strike up and encourage a national dialogue on this issue. And I'd like to also encourage the two of you to please feel free to respond to one another's remarks and make this conversation as engaging as possible. Asaf, our hearts go out to the citizens of Massachusetts, Boston in particular, who has suffered a significant COVID-19 impact. Can you bring us up to speed on where things are there? And can you also tell us a little bit about Ariadne Labs and its work?
Absolutely. Well, thanks so much for the opportunity to speak with you all today. I am really pleased to be with you in particular because I have some significant roots in Texas as well. My mom is from El Paso. I lived in El Paso growing up as a kid, and I have a lot of extended family in the Houston area. So it's nice to be connected from up here in the Northeast. We in Massachusetts have had a really rough time. And I can tell you this both as a public health leader and a practicing physician on the front lines. We tomorrow will likely pass nearly 90,000 cases, which make us in a small state of 6.5 million people. We will probably tomorrow have more cases than are reported in the entire country of China. And that is quite a statistic. It's quite a statistic to also understand that we've had almost 6,000 deaths. And, you know, it's been really hard, to be honest with you, on the front lines now since early March on this. We have managed through good systems, some luck and some good planning to have no overwhelming hospital overcapacity. Our hospitals have always been able to maintain being open. Emergency rooms and ICUs have been okay. It's probably a combination of we had the bad luck of being one of the gateways into the US in terms of international travel, especially from Europe. We had a number of super spreading events from global biotech and other conferences that happened in Boston in February that seeded a lot of cases. We didn't have enough testing capacity like most of the US. And we didn't know really what was going on until it really started to fill up our hospitals. But because we are lucky to have a lot of academic medical centers and level 1 hospitals in terms of capacity, we've been able to flip quickly into caring for our patients. We've actually, in my hospital, Brigham and Women's Hospital in Boston, we've been able to open over 250 ICU beds alone in my single hospital. Just as a point of reference, because I do a lot of global health work, as you mentioned, the entire region of sub-Saharan Africa, with the exception of South Africa, only has about 200 ICU beds. That just gives us a lot to think about how one hospital in the US has more ICU capacity than an entire region of the globe. That being said, what Ariadne is a public health laboratory sitting between a hospital and the Harvard School of Public Health, and we aim to reduce suffering and improve lives by these scalable solutions. And we've pivoted about 70% of our work during this COVID pandemic to making sure that we're addressing in areas of surgery, childbirth, primary care, and serious illness communication, ways to mitigate the suffering from this pandemic. And I'm sure we'll get into some of the ways that we're doing that later.
Well, thank you very much, and congratulations on all the great work that you're doing there, and please keep up the great work. Scott, HEB has developed quite a reputation here recently in its emergency preparedness and how you prepared for Hurricane Harvey, as well as this pandemic. In fact, it was written about in the Texas Monthly. Can you give us kind of a behind-the-scenes look at how you guys have prepared at HEB and kind of tell us what it's been like for you and some of your employees to be on the front line of this pandemic?
Sure. Thank you, Russell. Well, there's been nothing easy about this, that's for sure. You know, when we went through Hurricane Harvey, and most of the viewers who are on watching this today, I think, reside in Houston, and we all know what that was like. The big difference between a hurricane and this pandemic is with a hurricane, you see the storm coming, it hits and it goes away, kind of has a finite beginning and end to it. With this, even though we're 70, 80 days into it, we still don't know when and if it will end. And so it's somewhat of a trudge as we go through it, and we're adapting as we go. We have 120,000 associates, we call them partners, who work for us. On a weekly basis, we take care of 7.8 million customers. So on a monthly basis, we have more people go through our check stands than there are that live in the state of Texas. So it's a major undertaking to think about how do we process that many customers and take care of that many partners and do it safely. And so our first goal was to act with a sense of urgency and really put safety as our first goal and objective in everything that we did. We said up front that we needed to make sure that we handled absenteeism. And so we have a broad network of other retailers that we work with and know across the world and the United States. And so we visited with retailers in Europe and Asia because they were leading indicators of what was happening in their countries to understand what impact the virus had there. And we were able to develop a plan early on and begin to take action. And so we began to say, what do we need to do to make sure our employees felt comfortable coming to work? It's interesting, I was in a meeting with the leaders from the TMC and I heard Bill McClelland talk about shortages of masks and gowns and face shields. And when I came back, I was talking to Armando Perez, who's my number 2 here in Houston. I was talking about these shields and he said, shields? Maybe we need to develop shields. And H-E-B was really the first retailer in the United States that developed and rolled out the acrylic shields, and now you see them everywhere. But not only did we put them in front of the checker, we put them behind the checker, we put them in front of the bagger, we put them at the front of all the service counters, we put them at the pharmacies, we have them virtually everywhere. Secondly, we developed what we call a COVID action manager in our store, and this person oversees all sanitization, whether it's the sanitization of the carts, whether it's the wiping down of all the common areas in the stores, be that handles, check stand areas, but go through and we do that systematically over the course of the day. They oversee the metering of customers coming into the store and social distancing. And then we made a decision early on to procure masks. And this was initially, if you recall, the CDC didn't advocate for masks, and then they changed course. And before they changed course, we were already trying to procure masks. An interesting story about this is our first 2 orders were bought out from underneath us, a little bit like an eBay situation where someone paid more. Our 3rd order landed at LAX and then were confiscated by the federal government. Luckily, we had contacts with the FBI. The FBI went in and were able to get them released from the customs people there. We loaded them onto a charter jet. We got them back into our stores, and we were able to put all of our partners into masks right away. And I'll talk more about masks later on, but I do think they're an absolutely critical part of stopping the spread of COVID-19. The flip side would be just the supply chain. Every week has been something different. We've gone from sanitizer and disinfectant to basics like toilet paper and water, to looking at stock up items, rice, beans, canned goods. And then as people have had more time, you think about baking items, flour, sugar, yeast was something we were out of. And now we're dealing with the issues surrounding meat and proteins as manufacturing plants and processing plants have access to animals, the raw materials, but can't get them through their pipeline to get them processed and out to stores. So every week it has been something different for us. I'm proud of the way that our partners have responded. And I would say that we've done a pretty good job, but we still, unfortunately, have a long way to go.
Well, thank you, Scott, for all the great work that you're doing and keeping customers and your associates safe. I think you and Asaf got a number of things in common. Asaf, you and Ariadne Labs saw a need very early to take some major action. In fact, you published an article back in March that called for widespread social distancing and shutting down schools and work and public events of that sort. Can you tell us what it was that you saw back then that caused you to take that early action? And did that early action realize the results that you were hoping for?
Yeah, so, what we were seeing in late February and early March, and this is, one of the benefits to being, an organization that has both clinicians, public health people, designers, statisticians, et cetera, is that in our course of doing work with, 26 countries, and we do work with global health organizations, we were hearing a lot about this virus even in January and following it pretty closely. And as soon as it started jumping in East Asia, first cases in Vietnam, Thailand, Singapore, and seeing what was going on, we knew that this was going to be an issue if and when it got to the U.S., to Europe, and basically that meant that as soon as we understood that the transmission dynamics were both high, meaning this thing is much more transmissible than the flu and other conditions, plus it has this very difficult, what we call an asymptomatic window, about 5 days on average, in which most people will not have symptoms even while they have it, and a bunch of people will never have symptoms. Those, from a public health standpoint, are real danger zones. And the final piece of the puzzle to issuing our alert was really locally in Massachusetts. I'll even tell you, sort of looking out the window from the room that I'm in, as soon as people started discussing, school closures and work closures, and a lot of the narrative was, well, and we got this influx of questions, even to my wife, myself, about our kids. Well, should we have school at home, or should we have big play dates? There's a park near my house. I saw lots of people congregating. So I wrote an article called "This is not a snow day," because here in Massachusetts, we have lots of snow days. And what happens on snow days is, for many kids, including my own, it's party time. And it's sort of hanging out at home. And we wanted to put together 5 clear recommendations that lay out in pretty stark terms what now is kind of common knowledge about what social distancing actually means. It means this physical separation. And that really got us into a large segment of work on what we call community mitigation. What can we learn from the South Koreas of the world, from the Singapores of the world, from Japan? What can we learn from the struggles of Italy about what to do and what not to do, and really getting that information out and working with our state officials and national officials to get, a coordinated, robust response?
Well, you and your organization have been very proactive, and I think it's benefited all of us. In fact, one of the things that you did very early on, in addition to providing quite a bit of evidence-based information, which we all appreciate, is that you partnered with Harvard medical students to produce a shopping list. And that shopping list helped customers to think about the things that they should do before they go to the grocery store, what they should do while they're there, and also what they should do whenever they return home. Why did you feel the need to partner with Harvard medical students to create this list?
Well, in many respects, it's doing the things that I hear Scott and his organization doing so well. One of the things we've learned about this response in this public health crisis is it's not enough to just have evidence and have scientists and doctors get on TV and sort of tell you what you can and can't do. You have to make the information practical, memorable, and tractable, meaning like, I know I can hear what you have to say and I know how it might affect what I do tomorrow. And so we've always been an organization that's been really interested less in the esoterics of academics and publishing papers, though we use rigorous methods, and more, what is that convergent minimal set of things that one has evidence for that you need to do in order to keep people safe. We've done it with a surgical checklist that has been shown all over the world to reduce mortality before surgeries. When surgeons and their teams do these 19 things, your risk of dying in an operation is cut by 40% because they go down the list of these 19 basic things. It's that combination of things, that practicality of things. And so we said to ourselves, we've got to be communicators to tell people what is social distancing and what is it not, like for your kids, for your spouses, for your parents, for your friends. In the same way we said with grocery stores, people are asking every day, how do I go to Scott's grocery stores? And he's doing a great job with his team on putting up barriers and masks, but not all stores are. And so we said, well, what does the evidence tell us about what you need to know before you go, what you need to know during the visit, and what you need to do after the visit to reduce your risk based on what health conditions you have. And so at the end of the dialogue, I'll share a link. All this information is free online. We want it to be spread so that people feel more comfortable armed with the knowledge that they need to be safe in their communities.
Well done. We appreciate it. Scott.
Gustav, I have my list. There it is. I have my list right here. And as soon as it came out, we printed it off and compared what you were asking and was on the list that you developed with Harvard with what we were asking our customers to do. And I know this is one thing is, look, you can't sanitize enough. My fingers are cracked from how much alcohol I have on my fingers, but it's super important to go through and do. And one of the things I found early on that was interesting when I was in stores, this was back in late March, and here in Houston, Asaf, one of the big things that happened was the day that the rodeo was canceled was the same day that the NBA canceled their season. And this was a monumental day where all of a sudden it got real in a hurry. And we saw people just flock to the grocery store. And that was when water and toilet paper sales went through the roof, and we were just inundated with people shopping. And people then began to realize, oh, we need to stay home and we're going to have to hunker down. But what we saw happen was after about 3 or 4 days of this, people got tired of staying at home and they viewed coming to the supermarket as an event. And instead of coming by themselves, they would bring their entire family. And so I began to go on TV and I began to tweet and say, look, we want you to come to the store, but when you come, stock up and come by yourself, but don't put your family at risk. That's important for you to do. And that was important. And then similarly, and this is, I want to talk about masks for just a minute, because this continues to be very important. And I'll just say this, I hate wearing a mask, but I'm going to do it. And everyone should think about it. And to be frank is, I don't think our elected officials have done us any favors, because they could have positioned the wearing of masks as a patriotic act, as something that we could do to benefit each other and our fellow Americans. But unfortunately, it's been used as a political wedge when it shouldn't have been. And the fact is about mask is that when I wear a mask, it doesn't necessarily help me, it helps you. And when I think about it, look, I don't like getting a colonoscopy either, but when I get a colonoscopy, it benefits me. But when I wear a mask, it prevents me from spreading coronavirus to someone else. But most of us think that we're not going to get it, and we don't get sick until we do. The importance of wearing a mask is to prevent us from making other people ill. And the fact is if we wear them, then it lessens the spread of them. And the challenge that we have now is in counties where they don't have mask ordinances, is that people are choosing not to wear them. If you go to Brazoria, if you go to Galveston, if you go to Montgomery counties, you'll find the usage of masks in my stores are about 30% or less. If you find in Harris County, Bexar County, Travis County, Dallas County, you'll find 90% of customers are wearing masks today. And I think we're going to find is we're going to need to wear masks for an extended period of time, because from what I've read on this is we aren't going to find that COVID-19 is going to dry up and go away over the course of the summer. We're going to have to deal with this through the summer. And if it acts like 7 out of the 8 last flu epidemics we've had over the course of this last century, it will come back with a vengeance over the course of the fall. So masks, unfortunately, become a reality of something that we have to deal with. So Asaf, I would just throw it back to you and see what your thoughts are on it. But masks are an unfortunate reality. And for my partners in my stores is it becomes part of their uniform.
Well, Scott, if you don't like your current job, I'm ready to have you over in our public health organization, because you're speaking exactly the facts that I understand, and you're articulating the rationale, the use of masks in exactly the way that we in medicine and public health understand them. So I couldn't say it any better. And I would just say really congratulate you for seeing the evidence for what it is and for seeing the necessity. I mean, let me share very personally, I hate masks too. Whenever I'm seeing patients, I either have to wear the surgical ones or the even more awful N95s. And I've developed little cuts and bruises on my nose, and don't cry for me. I signed up for the medical thing, but we get no pleasure out of recommending that people wear masks. But the other thing that you said is critical, which is it is a patriotic, communal responsibility to wear masks to protect the people around you, to protect your communities. It is amongst the best things that you can do, because again, it's not really as much about protecting what's come toward you, but really your speech, your cough, your sneeze is going out. And I think one of the critical parts of our ability to get through these next waves across our 50 states is going to be to able to have a conversation amongst ourselves. Let's depoliticize it, because public health isn't on the side of one party or political spectrum or the other. It's everybody's shared resource and responsibility. And let's just have a conversation that says, we want to protect your workers, Scott. We want to protect my fellow healthcare workers. We want to protect your families. We want to reopen the economy. We all want the same thing. Masks, testing, tracing, and distancing. That's the pathway to do this.
When we have 120,000 people who work for us. With that many partners, we have had some cases at HEB. And when they happen, we have a transparent protocol in which we then go through videos and look at everyone through tracing that partner has come in contact with, and we sit down and have a conversation to let them know that they've come in contact. That's no fun. And if one person contracts the virus, that's one person too many. And so taking the steps to prevent it, look, it's a small price to pay. That's all I'm saying.
Well, I would just say, if I can share one thing from our really hard experiences in Massachusetts and the Northeast, this is a really nasty disease, and it takes with no mercy. I just lost a patient of mine a couple of days ago who I'd known for almost 20 years. I mean, it is relentless. It is a foe that we have not seen in decades. And I just want to share, if your community has been lucky enough, I know Houston's been affected, but let's say you're on this call in a community that hasn't been affected as much. I'm really happy for that. And I'm also really here to say, you don't want to see this thing. You do not want this in your community. And the mask will seem the most minimal of things to give up if you knew the other side. And so, I really want to think about, and I think, Scott, what you and other business leaders have been, who take this seriously and see this for its complexity, you're really, public health business leaders, because you're seeing your role not as just operating under these constraints, but really maximizing the public's capacity to interact with you, to maintain the essential service that you're offering through your stores, maintain that essential workforce, and do it in a way that minimizes sickness and transmission. I mean, this is what we need from across the spectrum of our economy and our political side and our government side.
And I'll just say this, and then we can move on, this is the way for us to be able to open the economy back up. Take the proper precaution as we go. So with that, we can move on, Russell.
Well, Scott, thank you. I think that's a great segue for where I want to move in our discussion. I want to talk about how we reopen our communities safely. Texas is effectively reopened without, I think, following the guidelines of national health organizations and without really following the data. Over the last couple of months, I think that we've done a pretty good job of containing COVID-19 to the extent that we can, and we've made good progress. As we reopen, how do we protect some of the gains that we've made when there seems to be this implied notion, erroneous notion that, that there's no problem or the problem is now behind us? And I'd love to get both of you to comment on that.
Sure. Why don't I lead out on this one, and then Asaf can counterpunch on it. So I think in terms of our state is initially everything was turned over to local leaders, and I really commend Judge Hidalgo and Mayor Turner in terms of the bold action they took with the stay-at-home orders and asking people to wear masks. If you look at our governor, he's really said as we look to reopen the state, is that he's looking at two key metrics, and that would be the hospitalization rate and the death rate. And he's wanted to use that as his guide as he looks to reopen things. Now, the good news is that our hospitalization rate really has flattened out, and it's stayed pretty consistent as we've gone. And we've gone from stage 1 to stage 2. And if we want to utilize metrics as our guide, what we need to do then is at each step is then take a chance to reassess and see where we are. And I think the question is going to be now in 4 to 6 weeks is, will we see another spike? And if we do, then what will our actions be? I think the reality here is that the genie is somewhat out of the bottle. We've opened up these businesses now, and I don't think we're going to go back down and have another shutdown like we did before. I also think, as I said earlier, is that there's zero chance of this thing petering out over the course of the summer. We're going to continue to be battling with people contracting COVID-19, and so we're going to have to continue to take precautions. So on the one hand, you know, it's a little bit like when you talk about public education. On the one hand, you can challenge how good our public educators are, but then the other piece is you've got to look at what job are people doing at parenting. So similarly to this is we can say, gee, what have our elected officials done in terms of reopening things? But then I think we also have to say is what is our role? What are we doing in terms of, are we social distancing? Are we sanitizing? Are we wearing masks? So we have to do our part also, because as we say, gee, we want the economy open, then as we want the economy open, we have to act in a responsible way. So if we go out to eat, if we go to a bar, if we go to a gym and do those things, are we acting in a very responsible manner? The biggest question I think is going to be for us as a society and for our elected officials is the need to game plan now for what we will do this fall should we see this come back with a vengeance as we have previous epidemics throughout the course of the last century. And what will we do if we start to see a big spike come in October, November, like we have seen in the past? And what will our plan be then? And it's hard to sit here and opine and say, oh, here's what we should do. But we do this at HEB all the time, is we do game theory when we look at competitive situations that we get into, whether it's with Amazon or Walmart or others. There's not a reason that you couldn't do game theory with regard to a flu epidemic that says, what will we do if the following things occur? And I would urge us to think about doing that.
Asaf, would you please respond to that?
Yeah, thank you. Thanks, Scott. I think we're really aligned here. I mean, a lot of people ask me, both friends and family, they say, you know, Asaf, how are we going to do this? You do a lot of social distancing stuff, and we can't keep this place closed forever. And I agree. This isn't a dichotomous decision. This isn't a binary decision. And as Scott was saying, you know, one of the things that being a doctor teaches you very quickly and early is that you have to make decisions with imperfect information, with risk calculations involved, and with time that's of the essence. And you do that in business, you do that in medicine, you do that in public health. There's a framework for reopening, and that framework is, we're converging on it. You want to read a great article? I can recommend my colleague Atul Gawande's article in the New Yorker this past week. I'll put a link up on there. Basically, what we've learned from the medical establishment on how to keep our workers safe in the midst of this unbelievable influx, and how it keeps your workers and your population safe. And it really boils down to 5 things, and they're not going to be a surprise. It's going to be about distancing. That means both space in between and also density, especially in inside spaces, especially in spaces that aren't ventilated well. So distancing is critical. It means testing, having enough testing capacity and use of that test capacity to actually diagnose as many cases as possible. It means contact tracing. How do we use a consortium of public health, state, and healthcare resources to track down the people who are testing positive, not because we want to infringe on their privacy, not at all, but rather how can we help inform the people that they've come in contact with that they need to get tested and that they may need to socially isolate for 14 days. The third part of this is masks and hygiene, and you've heard a great example from HEB on that. And the fourth is really also, you hear in a lot of HEB's work and in our work in hospitals, is really about culture of safety. You know, Scott mentioned that every HEB store has a COVID action manager, somebody responsible for supervising the cleaning, the density, the lines, all the pieces of this puzzle. That's what we do in healthcare. That's what we do in manufacturing to do safe manufacturing. You have people whose job it is to oversee the effective implementation of a set of evidence-based protocols. And that's what I would argue every business and every school is going to need to have, that leadership and that planning and execution capacity to make sure that they have their action managers not only overseeing the day-to-day protocols, but the supply chains that inform those protocols, the masks, the cleaning supplies, the shields, the barriers, etc. And then I would say that cultures of safety get at perhaps the core issue for reopening, which is about trust. It's about trust that says it's not enough for us to hope and wish and pray for safety and the virus not to come. The virus is 15 genes wrapped up in a ball of protein that don't care about politics, your opinions about the virus, or anything else except biology and math. And so if we don't acknowledge that, then we're going to get caught again at the mercy of this very wily foe. But if you acknowledge that we're learning how this thing spreads and how we need to make changes that are annoying, painful, and costly, but necessary, then we can build that trust that enables us to not just say we're reopening and not just reopen for 4 weeks or 6 weeks, but will allow us to reopen in a sustainable way such that another catastrophic spike doesn't happen, and such that it enables people to know that the health system is not overwhelmed and that they have the trust to go to that restaurant, to go to the grocery store, to go to their office. Because we can say we're reopened and we can wave banners that we're reopened all you want. But unless people feel that trust to come out of their houses and don't feel that they're putting their loved ones at risk of being harmed, then there is no reopening that can be sustainable. So we're all in this together, and let's get past politics and get to evidence and facts and a way forward. We know the 5 or 6 things that need to happen, and now we need to do them.
Thank you, Asaf. I appreciate that. You know, we've all seen a lot happen in the last 2 or 3 months or so. Have there been any lessons learned yet? Is it too early to determine if we've learned anything from this?
Well, I can tell you with all due humility on the healthcare side, we've learned some very, very painful lessons. And I'll name just a few of them for discussion. And we will have to have further discussions in this country about how we can reorient our health systems a bit. Look, we spend $3.5 trillion a year on healthcare in the US. That's about 20% of the GDP. And that's double any other country by far. Now, look, we have an amazing system of rescue care. We have the most amazing ICUs in the world. We have some of the most amazing technology in the world. We have breakthrough science, engineering, et cetera. But let me just tell you, as a member of the healthcare workforce and as a leader in our healthcare systems, we were not ready for this, because we in the US focus on rescue care and on ICUs and high-tech medicine, and we've not focused enough over the last 30 or 40 years on primary care and on public health, and most importantly on the connections between our beautiful, amazing hospitals and the public health system. Most other countries connect those because it's necessary to connect those. You see that in times like this, you see that in natural disasters. One cannot respond without the surveillance and capacity of the other. I'm really hoping and I'm positive that we're going to learn our lessons about what changes we need to make and what reorientation we need to make to serve our communities better and connect our community health systems to make them truly community oriented. So that's a big lesson, and we're going to learn that, and we're going to be ready with better stockpiles of equipment, with better stockpiles of ventilators, and with better knowledge about sharing information fast. I will say it's been incredible to see, out of adversity, incredible bonds are bred, and we've connected as healthcare clinicians. We have our networks that we've shared protocols on how to treat patients better, and within days we learned this ICU trick, that medical trick, this preventive trick, and we've learned how to restructure 70% of primary care nearly overnight into telehealth and virtual. A lot of that will stay and a lot of that will be good for patients, but we need to be better prepared for the next part. The other part of this issue is going to be really tough because of The way that we structure healthcare in the US is in terms of insurance, is largely employer sponsored, meaning that if you're working, most people's health insurance is still connected to their place of employment. We've got to think, in an economy that's going through such difficulty and with people losing jobs, how in the midst of such an incredible healthcare crisis and millions losing insurance coverage, how will we get them care? That's a very political conversation. I'm happy to have it, but it's something we all, from every stripe of the political aisle, have to face, because the next waves, as Scott was saying, I can almost guarantee you the next waves are coming. It's just biology and math. This virus has already spread in every state. It will have a resurgence. I can't tell you when. Is it going to be the fall? Is it going to be the winter? We'll be ready on the healthcare side, but we've got to also be ready on the societal side.
Thank you, Asaf. Scott, any lessons learned on your end at HEB?
Yeah, I mean, I think one of the things you find, and Asaf kind of alluded to it, is look, necessity breeds ingenuity. I give the analogy lots of times that if you don't know how to swim and you're walking by a rushing river and you fall in, you learn how to survive pretty quick. One of the things we knew early on is we were getting a lot of pressure to have senior shopping hours, to open up our store early for seniors to be able to come in and shop. The reality is that for people who are at risk like seniors, we didn't think that they needed to be out of their house. So was there a better way in which to look at it? So we bought a company called Favor, which is like Uber Eats or DoorDash, a couple of years ago. And we thought we could utilize them to be able to deliver groceries to seniors' homes. It took us 2 years to roll out to 40 more cities with Favor. We rolled out in 10 days to 75 more cities, and we were able to provide the home delivery of groceries to seniors at no charge over the course of those 10 days to all of the markets that we operate in. And so that's kind of the ingenuity that when your back is forced against the wall, what we said is, yeah, okay, we could take an hour or 2 hours of our operating time and make that for seniors, but is that the best answer and the right way to do it? The issue that we looked at was, okay, if you do it for seniors, then what do you do for people with disabilities? And if you do it with people with disabilities, what do you do for first responders? And pretty soon you've given and sold the little bit of toilet paper you have to special needs people, and then you don't have any left for anyone else. And so is there a better way to do it that can keep everyone safe? And we thought Favor was the best way to do it. And so what we found was that there was ingenuity, a way to look at it. And then I would say the other thing is just the ability to listen and learn from others. So if you think about things like olive bars, salad bars, soup bars, all of those things right now, not only are we not using them today, we aren't sure we'll ever use them again, bulk bars. And so we've seen stores go and repurpose them. So a soup bar all of a sudden now becomes a great way for you to put flowers inside of it, and it's a floral display. Someone took their salad bar and turned it into a party center, and they're actually doing $7,000 a week more in sales out of their party center than they did out of their salad bar. And so you just find that the ingenuity and thought process of people at the lowest level of your business. I always say I have 4 ideas and 2 of them suck and one's good and one might be okay. But when you have 120,000 people, all of them have one good idea. And to the extent that we're willing to listen, we can get a lot farther faster if you'll do that.
Thanks, Scott. I appreciate that. In the remaining time that we have, I want to try to take a few questions from our audience. Scott, this question's for you. We realized when we first got into this COVID situation, the grocery stores were literally wiped out. And I think some of the levels of products have improved, but there are still some products that are not there. Can you speak to when you think the product level for some of those products will return to meet customer demand?
Sure. I think the biggest challenges we continue to see right now are in hand sanitizer and disinfectants. A lot of those items are being, and rightfully so, are going to hospitals and first responders. Clorox is moving a lot of their products in that area, and you certainly can't fault them for doing so. You have seen a lot of alcohol producers, meaning the kind of alcohol we drink, going to making hand sanitizer, and we have gotten back in stock on a lot of those types of items. An item like vinegar we've had trouble getting, and an item like yeast, interestingly enough, because the people have had more time to bake or more time at home, they've been baking more. And then right now, the big issue we've had is with meat, although we've done a very good job of staying in stock. You might not be able to get a deep cut of pot roast you want, but you can probably get a pot roast in our store right now. I think you'll see this continue for the next 4 to 5 months, quite honestly, because what's happened, depending on where a plant is located, they may be hit with COVID. And we've also seen some raw material shortages. So for instance, right now on our HEB sodas, we're having trouble getting aluminum. There was such a demand on meat, we were afraid we were going to run out of meat trays. So it's interesting when you see it's not just about the demand on the products that's causing the out of stock. Sometimes it's on the packaging materials that go into them. And so it's much more complicated. You know, oftentimes I say, look, I stack cans for a living. When you peel back the layer of the onion, you find that there's more that goes into it. You know this because you worked for Kroger for a number of years. It's with 40,000 SKUs in the average supermarket. There are a bunch of balls, a bunch of cans to juggle at once.
Scott, you touched on meat. Here recently, we've seen the meat production plants impacted by COVID. Are there any recommendations or guidelines that we should be or should take into account when we bring those types of products home? How do we handle them safely? Or is that a concern?
No, I think, and Asaf can touch on this too. I think once you get them home, it's not going to be an issue for you. The bigger issue has been in the operating environment where they process them. And when you go into a meat plant, what you find is folks stand shoulder to shoulder, so it's very hard to social distance. We do run our own meat processing plant in San Antonio, and we've had no instances of COVID breakout because we have spaced our folks and we have put acrylic dividers between them. And we do test folks before they come to work. So we put the appropriate steps in place. But as Amarillo is a good example where they've had a major breakout in Amarillo, is that once it starts to spread, it's hard to get your arms around it. And they found this. And that doesn't mean that once that it starts, demand doesn't stop. People still want the ability to buy meat. We put a lot of our production capability into ground beef because it's so utilitarian in terms of how people utilize it. So if we can't get the grind in from the supplier, then we're actually grinding things like briskets and roasts ourselves to make sure that we have grind and we have plenty of poultry.
Asaf, this question is for you. We talked about, or maybe touched on a little bit, tracing, contact tracing. Is this something that we're able to do with cell phone apps? Or where are we right now with contact tracing, and how effective has it been up until this point?
We're not quite there where we need to be in terms of apps. You know, the major tech companies, Google, Facebook, all have, you know, announced that they're building or deploying apps soon. Most contact tracing is happening with your state and local public health departments in the way that it has happened for 60 years, phone calls, running lists, you know. So we've been asking folks, we have a major endeavor in Massachusetts, and actually it's to one of the other questions about, you know, how can young people who are facing difficult employment hurdles perhaps find useful employment. What we're doing in Massachusetts is hiring thousands of young people, and actually there's no age restriction. Anyone who wants and can work as a contact tracer to really work with us on this detective work. You know, running lists that were received from the state that have the list of people who are test positive, and then, you know, tracing back all of their contacts over the last 10 days and then calling those people whenever possible. We need to do this like other countries with apps that respect privacy. I think those apps will be with us later in the summer and into the fall. They're probably going to be a help, but a lot of this gumshoe detective work is still going to be necessary.
Right. Asaf, another question for you. Can you speak to parents who may be considering sending their kids off to summer camp or not? Is that something that you would recommend or not?
Yeah, it's a really critical question. It's one that my wife and I are actively deciding on with our 2 kids. You know, what I would say is you've got to look at the dynamics of your community itself, the community where the camp is located, and then it's a complex discussion around, listen, for us, you know, sending kids to camp in New England that has been so hard hit, and the idea of sending kids to live in closed close quarters, having kids from all over the country, actually all over the world, come to these camps. It's hard to think of a way from a public health perspective to do that safely. You'd have to quarantine everyone somewhere for 14 days away from other people, and then somehow basically lock the camp, essentially, and then have continuous symptom checking, and then hope for the best. This is not akin to what we'll face in the fall with schools. It's not impossible, and I know camps are opening, especially in lower prevalence areas. But this is a tough one because, look, we were hoping that COVID would not be a disease that affects kids. We're seeing with the rash of cases from New York and New England of a few hundred kids that have had an inflammatory response in their blood vessels that it can have a serious and rarely even deadly effect in kids. It still is a disease primarily of people who are older and who have other chronic conditions, but it affects everybody. And so this is a really difficult issue, and it's hard to sort of say with a blanket statement, yes or no, but I've been trending toward no, to be honest with you, especially in my area.
Okay, last question, and this one is for you, Scott. You obviously have responsibility for H-E-B stores throughout the state of Texas. What are you seeing in some of the other major cities like Austin, San Antonio, and Dallas? And how do we compare, Houston region that is, to how some of those other states are handling COVID and reopening?
Sure. I would say that if you look at the big cities, Dallas, Houston, Austin, San Antonio, that they've been very similar in their approach.
Okay.
Interestingly, Laredo has been an early leader in terms of how they've approached it also. I think there's a big divide between looking at how rural communities look at COVID and how major metropolitan areas. Now, a piece of that has been because of just the density of how close people live to each other and how much they relate to, oh, well, this happened in New York initially, it could happen in our area. But I know one of my coworkers went to a wedding in Brenham on Sunday, and he said in Brenham, nobody was wearing masks. Everybody was under a tent. And someone came up to him and said, oh, are you one of those city guys that's going to want to wear a mask? And so, his perception is that there's a somewhat of a divide between the way in which more rural related folks look at this versus more urban related folks. And if you look at the incidence of where it's occurred, and I think this is one of the things that hamstrung the governor initially, where you looked at the number of counties in the state that had outbreaks initially versus those that didn't. And he was, I think, appropriately so correct in saying we're going to make these local decisions in terms of enacting stay-at-home orders, because a county that had 0 cases probably didn't need to enact it initially, whereas Harris County, Bexar County, Dallas County needed to. Over time, though, I think as we've seen the number of cases occur in more and more counties, putting mask orders in place, certainly as we look to reopen the economy, makes a whole lot more sense.
Yeah, and I would just add to Scott's point there, a real plea for people to really understand the numbers and understand that we're early on. We're, like Winston Churchill said, we're not at the end. We're not even at the beginning of the end. We're at the end of the beginning.
That's a great way.
And listen, I have the statistics up right here. I keep them in my pocket every day. 9 out of the 10 counties in the US with the highest number of COVID cases per resident are rural counties. 9 out of 10. They're not in New York, they're not in Boston, they're not in LA, they're not in San Francisco or Seattle. They're in rural counties in the heartland. My parents live in a rural county in Minnesota. There are lots of cases there. So I just really want to plead with people to see this as, again, it's a bag of 15 genes that just spreads through biology and math. And this isn't a city disease. It's not a rural disease. It's not a disease of certain ethnicities or anything like that. It's just a virus that wants to spread. And common sense things like Scott has talked about, like I've talked about, don't have to change people's lives too dramatically, but they can immeasurably reduce the risks to yourselves and your communities.
Guys, we're out of time, but not questions. Thank you so much for your time. Enjoyed speaking with both of you. I want to also thank our viewing audience for joining us today and remind you to be on the lookout for more information about our webcast next week. Next week, our guest will be Margaret Oden, the city's COVID-19 relief and recovery czar. Thank you guys so much for joining us. I'm Russell Richard. Good day, stay safe, and be well.
Thank you.
Thank you, Russell. Thank you.